Hello and welcome to Cafdil Healthcare here on Cafdil Television. Today we're going to discuss non-communicable diseases, and we're going to know exactly what are those non-communicable diseases are, and also how different are they from the infectious disease, and also what do our lifestyle play in the development of the non-communicable diseases. My name is Kojo Arthur. I'm hoping that you follow us on all our social medias, that is Facebook and also on YouTube. Facebook, Cafdil Cape Coast, and also YouTube, Cafdil EDU. I have with me Abu Kwabena. He is a disease control officer from Cape Coast Teaching Hospital, and also Albert Amenyaglo, also a general nurse. I hope I mentioned your name
exactly,
right.
Exactly,
Yeah. He is a general nurse officer.
General nurse.
From Cape Coast Teaching Hospital. Gentlemen, you are welcome.
Thank you.
Say Amenyaglo, right?
Exactly.
Then I've done well anyway. I hope you are all good.
Yeah, we are all fine.
Fine. Let me start off with you, Abu. Abu is our regular panelist, right? So let me start off with you. What exactly are non-communicable diseases? And like I said, and how do they differ from the infectious disease?
Okay, thank you. Non-communicable diseases are a group of diseases that don't owe their existence to acute infection. So what I mean here is that the presence of non-communicable diseases is not because of a disease-causing agent. If I say a disease-causing agent, it can be biological, it can be chemical agents. But for non-infectious diseases, they don't owe their presence because of this disease-causing agents. But for infectious disease, they owe their existence or their presence because of a disease-causing agent. So basically, these are the difference between the two group of diseases. Another difference is that for non-communicable diseases, in fact, there has not been any pragmatic intervention that has been put in place. If I say that, what I mean is that just like the infectious diseases, their interventions are pragmatic. It is easy to implement. And so over the years, you would have, it will interest you to know that infectious disease was the leading killer among all diseases. But as it stands now, the non-communicable diseases that we are talking about right now is overtaking the infectious diseases or the communicable disease. Now, the whole thing is that because of that pragmatic intervention that was implemented, now the number of cases and death regarded to the communicable diseases are dropping far lower, and now the non-communicable ones are overtaken just because the interventions for the non-communicable ones are more like personal thing. So if I want to delve into that small area, what I mean is that all you talk about lifestyle and the role the lifestyle play in developing such diseases, what it means is that lifestyle...
I think it's a question that I'll come, it's a question on its own. So yes. I just wanted to know the difference between
the
communicable and
the differences. So let me just add something small. You see, if I tell you something like counseling, I want to open your mind on something, I want to draw your attention on something. Right. After I leave you, it's up to you whether you take it or not. That makes it very difficult to deal with some of these non-communicable diseases. But for the infectious diseases, we have intervention like vaccines. So when you take the vaccine, whether you like it or not, you are going to develop immunity against the next episode. And that is also some differences between those ones.
All right.
Yeah.
Let me come to Albert. Tell us, what are those, the most common types of these non-communicable diseases?
Yeah.
That is so common, yeah.
Okay. There are a lot of non-communicable diseases, but the two leading main causes are hypertension and diabetes. These are the two major conditions that are affecting a lot of people.
But apart from the two, what are other ones? I want more before we tackle it.
Cardiovascular diseases such as stroke and then heart attack, they are also common. Obesity is also part, and then injuries, they are all non-communicable diseases. And also the respiratory conditions such as asthma, they are all chronic non-communicable diseases, and then COPD, as known as chronic obstructive pulmonary diseases. They are all part of the.
Oh, okay.
Yeah.
So these are diseases that you don't contract from other persons.
No, not at all.
Okay. But through your own lifestyle.
Exactly.
Okay.
Exactly.
They cannot be transmitted from one person. Okay.
Yeah.
All right. So let me come to you again, Abu. Tell us the risk factors for developing this non-communicable diseases.
All right, thank you so much. So before I go to that, let me also add that cancers, all types of cancers are also part of the non-communicable diseases. In fact, I was telling you behind the scene that about 41 million deaths across the world as a result of non-communicable diseases, and they take about 71% of the total death globally. So just as he mentioned a list of them, you could see cardiovascular disease taking the lead among all deaths, about 17.9 million. And
that is worldwide, right?
Yes, worldwide, globally. So cardiovascular is there, and the second one is the respiratory diseases. They also contribute, and then we have the cancers, all type of cancers. That's why I want to highlight the cancer aspect. All right. So the risk factors, just as you just asked me, when you look at the common risk factors, we have abusive use of alcohol, tobacco. These are the most common types. And then unhealthy eating. Then we have mental disorders. We have psychosis, schizophrenia. Then those they are all part of non-communicable diseases. Then physical inactivity. You understand? If you don't do enough exercise, or your kind of work is that of sedentary type, they all play a role in the development of non-communicable diseases. So if you ask me, if you are a type who like alcohol and it is abusive, then there's an opportunity for you to take a decision for yourself. Alcohol, smoking, or the tobacco, they are all, they have their way that they will impact your delicate organs. They will impact it negatively. And one interesting thing I want our viewers to become aware is that, their onset is not an acute. If I say their onset is not acute, it means that it takes a long time. So by the time you start seeing some of the signs and symptoms of a non-communicable disease, then it means that you yourself have engaged yourself with that lifestyle for a very long time. And now you are now seeing that your delicate organs, depending on whichever organ it has been affected, you begin to show that particular signs and symptoms, showing that you are not well and it needs an intervention. And let me also say that their intervention or their cure, it is also going to take a long time. Sometimes you'll be on treatment for life. Sometimes you'll be on it for a very long time. So the risk factors are those things that I've highlighted.
But are these risk factors that you've mentioned, are they different across various age groups or demographics?
All right. So when you look at the tobacco use and you want to talk about demographics, one interesting thing is that in Africa, when you look at the ages, it is between 30 to 70. But in US, I think it is between 25 to 70 or so. I can't remember it offhand, but I have something around that area. So the NCDs are common among that age group. And when you come to the low and middle income countries, and you look at the demographics, the male counterpart, they are the very people who always die of this disease or having the disabilities and complications from these NCDs. Yeah, so basically that is the thing.
You made mention of abuse, alcohol and stuff. Nowadays, this you don't see the youth taking in smoking and that, but there's what we call shisha or something.
Yeah.
They abuse that shisha.
Yeah.
Does it have effect on them?
Oh yeah, that is true. You see, there is a negative impact on even using. You see, when we talk about the smoking, there are different forms. Okay. But whichever tobacco you use or whichever smoke you use, it leaves something within your system. That's why I'm saying that your lungs or your other sensitive organs can be denatured using that tobacco, shisha. Some even use, they call it snuff or asra or something. Yes, in all these things that you use, I'm saying that there is an addictive component in those substances that you use. So the moment you introduce them into your system, it is not you again. Now your brain, your mind, they will now demand for such substances. So it becomes very difficult for you to control yourself even if you don't get those substances. So you end up harming the organ, not because you want to do it, but because of the pressure or the addictive component in some of them. So shisha, yes, it's not good for you to abuse it. Now we are saying abusive because when you overuse it or when you overdo, even if you are eating food and then you overdo it or you overeat it or you don't take it in a healthy order, it has a negative implication or health consequences. So what it means is that we would have said that avoid it completely, those substances that I have highlighted. If possible, avoid it completely. But it is becoming a situation like, yes, so I should stop it and now do what? So even if we are in a healing process and we are taking you through a rehab or we are trying to help you, yeah, there is a way we will do it gradually and eventually you are out of the problem. So we are trying to say that, yes, we as health workers, we want you to be away from those things completely. Yes, so that is what I would say. But when you look at literature will tell you that abusive use of all those things. And I've said something here. If you just introduce them into your body, the rest is not you again. There will be pressure from the brain that, yes, we have exhausted what you gave us, so add more. That add more is the problem that you see some people on the street. Some cannot sleep in the house. People steal because they have to add the more the brain is requesting.
Because the body is demanding it.
It's demanding it. So if you don't supply, you are not free until you supply them. You understand? So that is making the whole thing a very difficult, not like the infectious disease that, okay, we can give you an injection, then you build an immunity against it and you are gone. Because you, in your own private way, something is asking you to supply nicotine into the body. I have left you, I have gone to rest somewhere. As a health worker, I have done my part. But you now, you know where you find those things to supply yourself. That is making it very difficult. And now they are taking lead. They're the number one cause of deaths across the world.
We are discussing non-communicable diseases with my professional from Cape Coast Teaching Hospital. And I hope those of you who have been abusing alcohol, shisha, cigarette and stuff, you're going to take a second look at it and make sure that you don't develop some diseases for yourself. Now, we're talking about all this. Let me come to Albert again. Okay. The lifestyle, we say lifestyle and stuff, which means you don't get this disease from other people. It's not transmissible, just as you said, which means your lifestyle, lead to this kind of disease. So what role do lifestyle play in the development of non-communicable diseases?
Okay, lifestyle plays a role in the development of these non-communicable diseases. The way the individual lives determine if you will be exposed to any diseases like these non-communicable diseases. So those who consume food that are high in lipids, the saturated foods, which are the animal products, they are more likely to develop these conditions. So we advise people to limit their fat intake, especially the animal proteins and animal fats.
So let me push you to, because someone watching us, what are those animal proteins or animal foods, or what are they? What are the examples of those things, those foods?
They are fat that we get from animals.
Okay.
When you kill animals, those fat that when you cook them, you can see the fat on the surface of the soup and all these things. Those
you have to avoid it.
To some percentage. And then take more of the plant oil and all those things that are unsaturated than consuming the high
plant oil. So it's granite fat.
Oh, it's
granite fat. Because me, I like granite.
It's very good.
I have to make sure I'm safe.
Soya beans and all those things, they are very good.
Okay.
They're very good. They're very good.
All right.
Then, as he said, avoid tobacco use. They are very harmful. Smoking always causes heart attack and all these problems. And also destroy your blood vessels, so that which affect blood flow, causing this hypertension and other cardiovascular diseases. So you have to avoid all these things. Very, very important. Especially smoking.
When he mentioned hypertension, I was expecting you to add diabetes because it seems they are twins. Abu, why do always when you hear hypertension, they go with diabetes? Somebody mentioned diabetes, he will continue with hypertension. What is so common about these two?
So what makes it them live in a small area or in the same range is that now when you increase in weight means that you have a higher risk of developing hypertension. Increase in weight means that you have a higher risk of developing the diabetes we are talking about. Everybody has to know his or her BMI. Okay, the BMI is the body mass index. So when your height and your weight, there's a way to calculate it to help you know whether you are obese. I remember my brother mentioned obesity. Whether you are obese, and even if you are obese, what level of obesity are you? So that the risk of you developing the twin brother hypertension will not set in. Do you get it?
Yes, I get it.
So the moment you live a lifestyle like more of sedentary, you don't involve yourself in physical activities. And you develop more muscles without you knowing your BMI, and you continue with certain lifestyle. I think I said that their onset of their signs and symptoms is not all of a sudden. It's over a period of time.
Sure.
Yeah, so when you get to know yourself and know who you are and begin to take a decision for yourself based on your health, these two things, you will not see them, you will just hear of them. If you go to the gym and the purpose of you going there is to make sure that you want to do a lot of exercise or improve your health, and you start and you don't continue, at the end of the day, results will not be achieved. So what I'm trying to say is that the hypertension and then the diabetes thing, if you don't involve yourself in any physical activity, then you should be expecting the hypertension. But hypertension sometimes can come without diabetes. Like the heavy alcoholics and heavy smokers, yes, they stand a chance of developing the hypertension, because we've already highlighted that your veins, your capillaries, and the arteries at a point can be blocked with nicotine and other things. So if that happens, now you are finding a nice way to tell the heart that yes, you should put pressure to be able to circulate blood to other parts of the body, and that is where the hypertension sets in. Right.
Okay, so we work, we go to work, we have a lifestyle to couple with our health and so on and so forth. I want to know, how can we balance all this to reduce the development of or to reduce the risk of developing diseases like the three that you have mentioned, hypertension, diabetes, and the obesity and stuff? How can we balance all of them?
Okay, it can be easily balanced. It depends on you, the individual. That's why I'm trying to say that these ones, they are optional. So you yourself, as an individual, should be able to take a decision for yourself. You know that exercise or physical activity is good to improve your health. So my portion is to draw your attention to that. Then the rest is up to you. You have to choose which particular exercise can I start and end with it. Okay, which type of physical activity can I engage myself with it? Then after that, you look at your work schedule, your busy schedule, and say, okay, maybe I have 15 minutes every day for that thing to happen. Okay, so doing this, even though you are still at work, you couple with family issues and other things, you still know that, yes, this is the time I think that I will not allow anybody to take it away from me because of my health. Because all this burden are on me because I'm alive. So you need to think about your life, how healthy you need to be able to take care of your work, your family, your other things. So you will now decide. So you can easily manage it through this simple thing I'm talking about. Yes. Sometimes I say it's simple, but it's very expensive. It's expensive because it's a discipline. If you start and you don't, and you leave it along the line, you end up worsening situation. So it means that you have to quickly go back to whatever lifestyle you are. If you are not doing it before at all, it's not a problem. But if you start and you don't continue, then it means that, I'm saying this because you can easily build weight rapidly. At the moment you start stopping, fat deposition, cholesterol levels, because you are consuming those food that you are not aware, you develop the fat deposition, adipose tissues and other things develop rapidly, and you end up building weight, and those complications can set in.
Okay. Would you want to add a little to what he has said?
What I want to say is that balancing this, your lifestyle.
Yes, your lifestyle.
To avoid all this. Health issues.
Health issues.
For instance, when you go to work, you shouldn't sit for too long, like more than 2 hours. You should get up at least every 30 minutes to 1 hour. You should get up and then walk, take a walk around, even the corridors of your work.
A situation like your situation where you have a lot of patients on you, and you said 20 minutes. Did you say 2 hours? 2 hours?
No, not 2. I'm saying that when you're sick for at least
2 hours.
2 hours, at least 2 hours, you should get up and then at least take a walk.
And I'm saying a situation like, let's say banking sector, for example. You have a lot of people lying, in a queue. How then do you get up and say, I'm taking a walk?
Or you can just go, like maybe you are going to the washroom and then come, not to walk, go out or any within the premises, as if you are going to take something from another person. Then
sometimes they even forget themselves.
Yeah.
They even forget
I noticed
themselves.
that.
Yeah. They forget themselves. People can sit down for more
as
than
if you are
3
going to take
hours.
something from, so that to improve circulation and all these things.
All
because
right.
if once you are seated, blood is not flowing as it has to be. You can develop this problem.
Since you've made mention of exercise and certain lifestyle, I want to know, Abu, that are there specific lifestyle changes or interventions, that can significantly reduce the risk of heart disease or stroke? Because you made mention of stroke and heart disease.
Yes.
Do we have specific style changes or interventions that can, drastically reduce it?
Yes. So just as we are here trying to draw our viewers' attention to the fact that there are certain lifestyles that they need to actually take a second look at, that is a number one thing. Then people who come to us at the diabetic clinic, at the hypertensive clinic, whichever clinic that they come, OPD attendants, and then those on admissions, we take opportunity to give them what is called counseling. That one is for you to know what is happening to you, know yourself better, and then take a decision for yourself. If I say you take a decision for yourself, sometimes if you don't know who you are, or you don't know what is happening to you, or you don't know what environment you have found yourself, you begin to live the way you want it. But the moment you begin to know that, okay, if I do A, I will get maybe Q results. If I do M, I will get Z results and all those things. You begin to become aware of yourself. So counseling provides an opportunity for you to know that, okay, this is what I'm supposed to do. Now, even those who smoke and other things, when you begin to increase awareness about the long-term consequences of smoking, then people begin to take a second look at the decision they took earlier, or those who are yet to even go in also, advise themselves appropriately. Now, let me highlight this. There is what we call IHR, International Health Regulation. It's a legal instrument. Yes, they regulate all health activities, and then they make sure that all diseases, including the non-communicable ones, are reported to WHO and then its partner CDC, so that we can know what is happening to which country and which disease that is there. So because it's a legal instrument, they are trying to make sure that consumption of certain foods are taken out, especially the cigarette thing. It's a very difficult situation. So the only thing to get the changes done is to educate the public as we are doing. Ideal situation is that if there is no cigarette, if there is no snuff, if there is no shisha, they are the risk or the substances that increase risk of developing non-communicable disease. So if they are not there, the risk is not there. Is that not it?
Yes.
But now, even, I don't know, if 2 CDs or 1 CD crack, you can get cigarette to smoke. It's very simple and easy for everybody to get it. I don't know if you get a picture.
Yeah, I get it.
So the basic thing is to draw people's attention to the fact that if you take cigarette, this is going to happen.
But I think they've written on the box, cigarette box. It's
not
harmful.
all of them. I'm trying to create an awareness in the form that even if you can't write, you can't read. Sometimes, yes, educated people also smoke. I will not take that out. They also smoke. Even sometimes the most people who smoke. But there are some people who even don't read what is on the leaf there, or they don't know what is there. So speaking to your ears sometimes brings more results than we expecting that they should buy and read. Sometimes they say this, If you want to hide something from an African, you put it into writing. I don't know whether you've heard it.
Yes,
I'm the only
if you
person
want to hide anything, something
from an African,
put it in a book.
Oh, okay, or put it into writing. So they will not even spend time to look at what is there. But if you speak to their ears, maybe okay, he can now say, "Oh, Mati, it's up to me to say I will accept or not." So creating the awareness and that thing is there. And then at that level that I'm talking about, the WHO and the Human Regulation Law, they are all there. They are aware of this particular, because it's a global health threat.
Sure.
Like I said, 41 million each year, they are dying, and it's not one geographical area across the globe. Everybody is dying. So their eye is open on that particular problem. But there is a big problem because the strong and the big men are behind the production of such substances. So you fight them here, and then they also fight you here. So by the time you come back to yourself, what you are trying to prevent has escalated somewhere. So that is how I think the changes could be.
All right.
Yeah.
And Albert, you also made mention of not eating well, and that's, and I what we have heard that balanced diet, if you want to eat well, supposed to be your diet is supposed to be balanced, right? So I want to know, how can this balanced diet help prevent non-communicable diseases?
Okay, they can actually help to bring down the diseases, especially when you limit your fat consumption to the percentage that you're supposed to take, especially the animal proteins and animal fat. When you limit them to at least 10% of your daily consumption, it can help you. And then the carbohydrates and all these things, there are percentages you have to take. You don't have to exceed for a day.
Okay.
The calories. So when you limit all these things, and then also see the dietitians, I get me.
Yeah.
Those who are diagnosed, when you see the dietitians and they plan your diet for you, all these things can
reduce
so that you don't get complications. Because all these things, sometimes they lead to kidney failures and all other complications.
But do we have specific foods that are particularly beneficial or harmful?
Yeah. Those that are more beneficial are the fruits and vegetables. The fibers and then the proteins, they are more beneficial than excess carbohydrate and all these things, which can lead you to gaining excess weight and then become obese and all these things. They all help.
And the harmful ones are the oily ones that you made mention of.
The excessive, yeah.
Oh, okay.
Yeah.
All right. But in our economic situation now, it's not easy to get what you mentioned.
Yeah.
So we will continue to develop this kind of disease. That is why, if I heard Abu Vero, he said, is it middle income countries?
Low and middle income countries
develop kind of disease like that.
They develop
because there's no money where you can balance your diet every day.
Exactly.
Oh yeah, you see, when you look at the report closely from WHO, it's not because of the money as such. Or money can contribute because maybe you are not able to feed well. And I told you that the nicotine consumption or the tobacco consumption reduces your level of appetite.
Okay.
So people begin to say that, okay, if I can use maybe 2 cedis to get my cigarette and go my way, that would be far better than me getting like 20 cedis to go and buy and take a then I can eat it for the whole day, or I can't eat it for maybe 2 days. But 20 cedis, you get like maybe a packet of cigarette, no appetite. Then you will just continue doing it, and then those things are there. But elsewhere, they are smoking. Or even if they smoke, they have other food substances, other things to supplement or take the immediate effect of the nicotine and other things. That is if you have money. There was a research that was conducted to actually see countries where they smoke most and where it-related death occur most. I don't have the literature of it, but I remember that France and then Germany and England were the three big countries in the Europe that were used to do the.
They are close.
And then you can see the smoke heavy. Those of you who have been there before, or any viewer who has been there before, will attest to the fact that they like doing alcohol and smoking a lot.
It's because of the weather.
Very good. Let's say it's because of the weather. But whatever it is, whether it is hippic, whether it is what, the most important thing or the basic thing is that you are introducing the nicotine into your body. But when you come to our certain low and middle income countries, the weather itself is already hot, then you are also increasing those levels. So when you look at it closely, yes, economic issues are there. Socioeconomic issues are there. They contribute to the reason why the death toll is among the low and middle income countries. You understand? I also highlighted that there are psychological issues or mental disorders, and they all influence how they go into taking these drugs so that they can accommodate themselves.
Sure.
Yeah.
Right.
So these are some.
If you just tune in, you are watching Cafdil Healthcare on Cafdil TV, and we are discussing non-communicable diseases, very dangerous disease, which is of course killing a lot of people, and we don't want you to fall victim. But what are some of the signs or symptoms that people, should be aware of for early detection of non-communicable diseases, common ones like hypertension, like diabetes, and so on and so forth? Albert.
Okay. If you are there, suddenly you are having palpitation and then chest pain, you have to go to the hospital so that they can assess you. And then
What is palpitation?
your heart will be beating too fast. Palpitation.
Oh, okay.
And then chest pain, sharp pain, they are all signs that you are developing hypertension or something is happening to your cardiovascular system. And also, if you pee a lot or urinate frequently, you must also go and then check your sugar level and then see whether you are developing diabetes or any other conditions. And also, if you are increasing weight, gaining weight, you should be watchful. You should also,
But in Ghana, if you are gaining weight, that's why we say, come on.
But
Hey,
you are most likely to develop hypertension and diabetes. So you should go and then check your blood pressure. Go to a nearby pharmacy, at least check your blood sugar and then your blood pressure, and then see what the figure is pointing towards. And they are silent killers. This condition, you develop them, and then you know. You still be doing your normal work.
Someone like you and I.
Yeah, exactly.
With the same,
exactly.
If you begin to gain weight.
Until something happens before they'll diagnose you that, oh wow. Before they'll get to know that, no, your BP is high, your sugar level is high, by then it starts damaging you. So I think early screening is very, very important. You should be screening and then regular checkups and all these things so that all the figures are pointing toward they can. Very, very important.
You made mention of fats and so on, but I want to ask Abu that what is the impact of sugar, salt, fats intake on diseases like diabetes and hypertension, and how can you make a healthier, choices?
Okay, so let me thank you and say this: sugar, salt, like you just said, fats, yeah. So he said some of the fats are saturated, they are solid at room temperature, and they can easily block your veins or the tubes within which blood passes. So if you are consuming them, you should become aware of this to be able to deal with that particular health implication. Sugar, salt, they also have a sodium component in them. The more you begin to take too much of it, it has a way of hardening these tubes I'm talking about. When they become harder, they become narrower. And because of that, the heart will have to get another power to be able to strike well and to be able to share blood. You understand? And the sugar issue, let me say this. Sometimes people think that when you eat too much sugar, you get diabetes. Oh yeah, we common hear those.
Yeah, sure.
Stories.
It's true.
Yeah. Sugar, depending on which type. Diabetes, depending on which one we are talking about, does not necessarily occur because of more sugar intake. But diabetes mellitus like this occur just because an organ in your body is defected or is not functioning well. Your organ like pancreas has the ability to produce two common hormones or enzymes. We call it glucagon and then there's another one. But the insulin. The purpose of the insulin is to make sure that they do a lot of, they have a lot of functions, but the insulin has to take the excess glucose from your blood and keep it for you so that you can use it any other day whilst you are waiting for food that you have not eaten. But if there is a problem with the pancreas and it can produce the required amount of insulin to be able to perform that function, then it means that the excess blood, the excess sugar will remain in the blood. They will take the prick of your finger or your hand and then use a kit or a device, we call it glucometer, to pick your blood sample. Why are we picking your blood sample? We want to know the level of sugar in your blood. Do you understand? So if the level of sugar in your blood is away from the normal range, then it means that there is a problem. So as part of the screening guidelines, that is what we do for diabetes. I'm saying this because people think that too much sugar will give you that particular diabetes, but that is not really the issue with it. Yeah.
Okay.
Yeah.
Well, very soon we'll draw the curtain, but I want you to tell us how can we as individuals take responsibility for our own health to prevent non-communicable diseases, and also what step can we take today to improve our long-term well-being?
Okay, that's fine. So as an individual, it is important to adhere to health interventions that are already in existence. Because if it is the only way out, you have to be aware of health consequences or the health complications that are available, and what do I do to be able to stay away from them. That's why we spend time to educate the public on some of these things. So when you become aware, that is the number one thing. And then the step you can take is that let me do the do to be able to stay away from the risk factor. You know, if the risk factor is not with you in the environment, you don't develop it-respected disease.
All right.
So if the risk factors are available, then it means that you are at risk of developing some of the diseases. So as a responsibility, like my brother said, you don't need to begin to develop signs and symptoms of a particular disease before you seek a health care. So for you to be responsible for your health, from time to time, you need to do what is called screening. Because during screening, that is a primary prevention. That one, let me just say it's a preventive method. So during screening, you don't show signs and symptoms. So, but we are trying to go and see that what is happening to you. If you have already been infected, there is a period for an incubation period. This one, we are not talking about infectious disease, so I don't want to delve that much. Even with the non-communicable ones that we are talking about, because the onset of signs and symptoms is not rapid, it takes a long time. It is good for you to do the screening and pick a signal to see what is happening to you, so that you will sit back and say, okay, if this is what I'm seeing, that I'm going to do A, I won't do B again. I'm going to do A, and I will make sure that I will change things. So from time to time, for a responsibility, you have to be sure you know yourself and what is happening to you. Quite recently, we just dealt with one of the cancers I was talking about. Breast Cancer Awareness Month just ended.
Yeah, sure.
So we took opportunity to also sensitize the public, particularly our women, our sisters, our wives. Men also have their cancers. We'll talk about them maybe other, but because they are all non-communicable ones, so that they can all examine themselves as part of early detection to know what is happening to you. We took them through how to examine their own breast in their own private way to see what is happening to them. The moment they see any changes, and as a woman, you should be able to know yourself and know your breast very well, so that if there is a change, you should be able to know that there is a change. But if you don't know it and there is a change, you will not be able to even know that something has happened. So you should be able to know yourself, and that is by way of screening, and then also adhering to other available interventions that are there to be able to sustain. I don't know if I've answered your question.
Yes, you've answered. Our time is up, but let me ask this one last question, and we'll draw the question. But there are some people going through a lot, and with this non-communicable diseases. So how do people with those diseases, overcome the psychological challenges, of living with that chronic conditions? And what coping strategies can they use?
These non-communicable diseases, the treatment are long-term therapies, and this patient need to be supported, counseled, so that they will accept their conditions. If they accept their conditions, know that they are going to live with the conditions for a very long time or throughout their lives, they won't be depressed, and they have to support them physically so that they can all the time go to their checkup and also access their medications. So families have to play their role, the healthcare professionals have to play their role, and then support them. And they can also, because of the depressions and then issues surrounding it, those who are having the same conditions like diabetes and hypertension, they can form groups and associations so that they can support themselves. And also,
yes, like those with HIV.
Exactly, they form clubs and then groups so that they can support themselves through maybe social media platforms and all this, and so that they can reassure themselves and then live with the condition, because there's no cure. Sure. You only manage it, and then lifestyles, modifications, and then all these things. These are the
we are living. Yeah. We go in. What do you have for our viewers?
What I wanted to say is that we should take the precautions so that we don't get these conditions, because being on the treatment for the rest of your life, it is not easy taking medication daily.
Not at all.
So primary prevention is key. We should always try and check our blood pressure, our sugar levels, at least once a month, so that when the figures are pointing towards abnormalities, we can change our lifestyle so that we won't get there. Whereby we'll put on medication, because it's not easy taking medications. We'll definitely default, so we don't want to get there.
Abu, we are leaving. So what do you have for my listeners? My viewers.
Yeah, so I want to thank our viewers for having our conversation. And I would say that we don't have a technical eye that can physically look at you like this and say, you are sick of this particular disease. Yeah, so the only thing we can help our viewers and the public is that we will sensitize them on some of these things. And we are available, and we are there for them to come for our services. Mostly this screening thing, most of them are for free. Sometimes we even bring the hospitals to the communities to screen and then see what is happening to them, particularly on this disease. And the psychological issues are becoming very common. And the little I can say is that, yes, there is pressure, or there is some kind of economic hardship and other things, but they should be mindful of the fact that if you don't have anything, you don't worsen it by becoming sick. Because you now, you don't have anything. So if you become sick right now, taking care of yourself and your family becomes a problem. So they shouldn't give themselves a high expectation in anything. Because if you expect something so much and you don't get it, you become disappointed. Your heart is breaking. It is not only relationships, boyfriend, girlfriend, that breaks heart. Yes, there are a lot of mediums or ways of heartbreaks and heart attacks, psychological issues. They shouldn't give attention to some of those things.
All right.
So that we can live healthy.
Okay.
All right.
Okay. Thanks so much for coming. Abu Kobina is a disease control officer, Cape Coast Teaching Hospital, and also Albert Amenyakulo. Oh, this time I get the name correct. Yeah. Also a general nurse from Cape Coast Teaching Hospital. Please take responsibility for your own health in order to prevent yourself from this non-communicable disease. Thank you so much. Thank you to all the crew. I don't want to mention names, else I'll be beaten. So to the crew, thank you so much. Thank you for watching. If you have any question, please leave your question there on the comment section on Facebook, whether you're on Facebook or YouTube. Certainly it will be answered for you. My name is Kojo Arthur. Same time next week. God be with you.